Okay, so thank you all so much for being here today for our very first tobacco prevention and cessation specific coalition. We decided to separate our Healthy Communities Coalition into two separate coalitions, one specifically for health coverage and the other specifically for tobacco prevention and cessation. And we did this just to be more efficient and effective with our work. So we really want to start taking action and making change regarding tobacco control in LaPorte County. And we believe by bringing together passionate people who have similar interests and goals will help us really accomplish that. So again, thank you for being here. So just to give you, if you guys wouldn't mind muting yourselves until it's time to introduce, that would be great. So just to give you all an idea of what the tobacco burden looks like here in LaPorte County, I've pulled together some statistics to share with you all. So in Indiana as a whole, 21.1% of adults smoke cigarettes, but in LaPorte County, that number is 29% of adults who smoke. So there is a big difference compared to the overall state. I wanted to talk about pregnant women. So 19.9% of pregnant women smoke cigarettes. And in the state of Indiana, that number is only 11.5%. So there also is a big issue with our pregnant women and tobacco use as well. And this is a major contributor to infant mortality, which is a big issue here in LaPorte County at 8.1 deaths per 1,000 live births. And that's higher than the state amount at 7.1. I wanted to also talk about youth. So in 2018, 18.5% of Hoosier high school students and 5.5% of Hoosier middle school students used e-cigarettes. And that was from the Indiana Youth Tobacco Survey. And we'll be getting newer statistics soon. But from the 2020 Indiana Youth Survey that measures more than just tobacco use, it gives a better regional look into what e-cigarette use looks like. So it's not specific to LaPorte County because it lumps our data in with Lake and Porter counties data, but it will give us a better representation of what e-cigarette use looks like in our area. So what I found really interesting in that data is that we are within Region 1, and it breaks down Indiana into 10 regions. And within Region 1, that consists of Lake Porter and LaPorte County, our region was in the top highest for vaping use in 8th graders at 11.7% out of the 10 regions in Indiana. In addition to that, 10th graders were number one highest for vaping use at 20.2% out of the 10 regions in Indiana. So e-cigarettes, vaping, it's on the rise in our area. Finally, I just want to speak a little bit about secondhand smoke. So in Indiana, approximately 1,770 Hoosiers die each year from secondhand smoke and premature loss of life. And that's about $328 per person each year in excess medical expenses and premature loss of life. And research shows that although secondhand smoke exposure rates have dropped, some groups continue to be exposed at much higher rates than others. And in addition to children, Black non-smokers, people who live below the poverty level, those who rent housing, and workers who live in specific workplaces have higher rates of secondhand smoke exposure. So that really emphasizes how we need to have a health equity lens in tobacco control. So I just wanted to set that foundation for you guys to show that it really is an issue in our area. And I now want to introduce our guest speaker, Shirley Du Bois. Shirley received her bachelor and master's degree in Park and Recreation Administration and Health from Eastern Kentucky University. She currently resides in Kokomo, Indiana, and was the tobacco-free coordinator in Howard County for 10 years. In 2017, Shirley was a leader on the Howard County, Kokomo County City Council for adopting a comprehensive smoke-free air policy for Howard County. And she became the North Region Program Director for the Indiana Department of Health and their Tobacco Prevention and Cessation Commission. And in total, she has been working in tobacco control for over 14 years. So today, Shirley will be telling us about her experiences in leading a tobacco-free coalition, what her coalition looked like, and some accomplishments her coalition was able to do together. So without further ado, join me in welcoming Shirley.
Thank you. And I'm excited to be here and to talk to all of you. And just excited to be working with you and have this opportunity to share because we are very proud in Howard County what was accomplished through a coalition. And so Melina set it up very well of the problems and you know, this group can come up with some solutions to bring those numbers down. Of course, the state's work plan is divided into 4 priorities: working with the youth and the adults in cessation and getting marginalized populations involved. So hopefully this and specifically focus on helping Melina and Sue with the work plan from TPC for the grant, which is a 2-year grant. So basically, like Melina said, I was the Melina in Howard County, and we set up a coalition. And first of all, you may know some of these because, again, tobacco-free coalition is same as other coalitions, okay? Same focus, same mission, same cause. I mean, not the same cause, but it's all about a cause. Ours is tobacco control. But you'll notice that with a coalition, you also have partnership. Okay, so in Howard County, we had what we called the core coalition, and that existed of 12 members on that coalition, okay? That specifically, it was a tobacco-free coalition. We met monthly unless we were working on a project or an activity, and then we met more. But I keep saying the core because there were about 12 members. Now, that doesn't mean that we didn't have a lot of partners. We had over 45 partners in Howard County, Kokomo, that contributed to helping us with our activities and projects. But again, that core met monthly, very, very involved because of their passion for tobacco control. So again, there's, as we know, in a coalition, there's recruiting, there's coalition structure, there's motivating, there's even dealing with what I call conflict management, because we're all not going to agree on one coalition, achieving goals, advocacy, policy, resources, and my favorite, celebration. So again, with Howard County, we had those 12 core members. The table. So it wasn't just all one sector. It wasn't all just what I call the grass tops, okay? The health providers, the hospitals, those kind of organizations. We also had what we call grassroots, which is your non-traditional partners. So when you think of a tobacco-free coalition, please don't think of it as all health providers. And probably within this group that I'm looking at, you're probably on each other's boards, which is very, very normal. But with the grass tops, you have the grassroots, again, non-traditional partners, maybe somebody from the YMCA, maybe somebody from law enforcement. And so we had a well-rounded, diverse 12 core members, diversity in what they did as a professional, retired, you know, even we had some people not working, you know, stay home, from the neighborhood. So again, we wanted that well-rounded with organizations and professionalism. We wanted it well-rounded with age. So youth was involved. We had a youth participant on the 12 coalition, or somebody that represented youth per se, because we have a voice component to TPC, and we had that in Howard County. So we had representation there. We also looked at diversity as far as age, diversity as far as male, female. So we, again, had a very, what I considered well-rounded coalition to help with our mission. So again, the structure of ours in Howard County is we met once a month for an hour. We had an agenda. It was very specific. We had shared time because, again, when you're involved with the coalition, you want to support one another and for what they do. And so like we had a Head Start representation. So because they were involved, I was involved with Head Start. I was on their policy committee, the recruitment committee, and the health and wellness committee. So again, with our coalition, we worked really, really well together to help and support one another because we all bring something to the table. Again, as far as our structure, we broke it down into subcommittees. We know that not everybody can be at every meeting, but want to be involved. So we broke it up into subcommittees where we found out what works best for them, what their skill level was, how they can contribute. Our mission and goal was always more hands, less work. But again, not everybody, we're all busy. I hate when people say, hey, I'm going to call you. Are you busy? Yes, we're all busy 24/7. We're busy. So we're all in this boat. So we kind of, again, broke it down to understanding that not everybody was going to be at every meeting, but yet they wanted to be totally involved. So our subcommittees were broken down into youth, a steering committee, a policy committee, and a communications committee. And it helped. Again, we found out what the strengths and the weaknesses were all for our members, and that we could all bring, the same, not the I mentioned conflict management. That was important for us to establish when we first formed our coalition, to talk about how are we going to come up with a majority of the rule. Did we want to have a voting, kind of way of doing our activities? I mentioned that because a lot of times we would get asked to sponsor things in the community. And so I always brought it to the attention to the core coalition, and we talked about it, discussed it. And then we kind of said, does the majority feel that this is well worth our money, spending our money sponsoring? And that's how we came up with our way of act, whether we say yes or no, but you can come up with your own structure. That's totally up to the group. But we knew that there would be times that there would be some heavy discussion, and how are we going to work with the conflict, of people not agreeing. And so basically what we tried to do was negotiate most of the time, have that discussion and then negotiate our way through that. Achieving goals. Of course, Melina has the work plan. So it's not like your coalition and our coalition had to come up with, what are we going to do? The work plan is right in Melina's hands. It breaks it down very, very specific and focus on what we call indicators and deliverables. So again, the work plan was shared every coalition meeting so that we knew what we were working on. And then, of course, in 2014, we were encouraged to go comprehensive smoke-free in Kokomo and Howard County. So that became our real mission. Not that we didn't work on all the other indicators, but what we call policy work is indicator 5, working on getting smoke-free work sites, schools, so we worked heavily on that. In 2014, we asked the council for the county and the city to put it on their agenda. Went through the process. It did not pass. So again, for the next 3 years, the coalition met monthly and again weekly. Policy committee was working nonstop, bringing that information to the total core coalition every month. And we worked and worked and worked until March of 2017. And on March 6, 2017, a policy was passed for Kokomo and Howard County, totally comprehensive, including bars, including membership clubs. So we're very, very proud of that. And that's, again, part of the coalition achieving those goals. And that's probably one of our biggest accomplishment. Now, with our coalition and me as the tobacco free, I love to celebrate. So we celebrated all the time in our coalition, whether it was small victories or the big victory of going comprehensive. So again, at Howard County, I guess we like to party, but even to this day, on March 6th, you know, up until this year, because I've taken on this new role, I would buy a cake and we would celebrate that we went comprehensive smoke-free. And we also celebrated that no business shut down, you know, and we also celebrated that 2 businesses were added, you know, 2 other bars opened up smoke-free, knowing they had to open up smoke-free. And then we celebrated again all throughout the year with a little accomplishment, such as, and again, you may not know, but point of sales is where the state gives Molina X amount of stores and we have to survey how they market. And you collect all that data. So we celebrated when we got 138 stores surveyed, and we celebrated our monthly meeting. So things like that, we constantly recognize the hard work that everybody put into it and acknowledged it. And then of course, once 1 year out of, or two times a year, because it's a 2-year contract, we celebrated and recognized coalition members. So in Howard County, what I did is, you know, everybody that's on the coalition expects to give something, but there was always that one coalition member every year that went beyond. So I created an award that was called And Then Beyond. And so we presented that award every year to a coalition member that went beyond what was expected. And then resources, of course, the resources is Molina has some funding for the Tobacco Coalition, that the coalition is indicator 14. So she has resources as far as materials and that she can provide. And then again, the policy work and the advocacy work. And I will note that on a coalition, we are all advocates. We are not lobbyists. Lobbyists get paid to do the advocacy work. So I always mention that we're all advocating for tobacco control issues, whether that's at the local or whether it's the state or even the federal level. So I think that's what you want in Molina, hopefully. And I entertain questions or comments.
Yes, Shirley, that was perfect. Thank you so much for your time and your insights. We truly appreciate it. If anyone has questions for Shirley, let me know and I will get those answered for you. Shirley, feel free to hop off the call whenever you need, but thank you again so much.
My pleasure. And again, as the RD now, even building this coalition to being excited of what you're going to accomplish as well. And thank you. And I'm going to stay on until I have to hop on for another meeting.
Perfect. All right. So as you heard, the Howard County Coalition was quite successful. Now this, as Shirley said, this doesn't mean that our coalition has to look exactly like hers, but there are some aspects that are really important in a coalition. And it's important that we use our coalition to mobilize our communities around tobacco prevention and cessation, to really educate our community on tobacco related issues and try to create widespread reach. And then just to use it as a forum for knowledge, skills, and resource sharing, as we all have diverse backgrounds and we can bring something different to the table. So now we will jump into introductions. So every attendee will be called on and asked to briefly introduce themselves. If you have any agency announcements that you'd like to share with the group, please put that in the chat, and then I will make sure those announcements get shared with everybody afterward. In addition to briefly introducing yourself, I'd like you all to please tell us why you made the decision to join this Tobacco Prevention and Cessation Coalition. So while you all are thinking about that, I will go ahead and start us off. So my name is Melina Rivera, and as you know, I'm the Tobacco Program Coordinator for Healthy Communities. And the reason I am doing tobacco control work is because I have a strong background in public health, and tobacco use is a huge public health issue that is often overlooked. And there are so many disparities involved with tobacco use. And it really gets to me that vulnerable communities are being targeted by the tobacco industry. So that's why I do the work that I do. So Sue, would you like to go? Sue Reed?
Good morning, everybody. I'm the Executive Director for Healthy Communities, and I come to this more from a personal level. My brother-in-law actually passed away about 5 or 6 years ago from lung cancer, started smoking at a very young age, knew he was ill, but didn't want to accept the signs until his sons practically took him to the doctor, and he was diagnosed at stage 4. And it was so hard for him. I actually think he smoked up until the day he died, even though he was on oxygen. So it is a very strong addiction, and people, I don't think, look at smoking as an addiction. You always think of drugs or alcohol, but it is. And so any part that I can play in helping our youth to not start smoking and or get people involved in cessation programs is very important to me. Thank you for joining us today.
Thank you, Sue. Rashana?
Hi, I'm Rashana Hood. I'm an outreach and enrollment specialist with Healthy Communities of LaPorte County here. And I'll be assisting with the Tobacco Coalition whenever possible. My background with it is I've had a lot of family members who have been addicted to cigarettes and tobacco products. I had an uncle who was really sick at one point, and the last thing he did before he passed was smoke a cigarette, and that kind of contributing to his passing. So I definitely want to assist, and especially with, the youth, and letting them know early on the things that can happen with tobacco usage. I appreciate you all for being here.
Thank you, Rashana. All right, I'll start calling from our participant list. Lee Morris.
Hi, I'm Lee Morris, and I'm delighted to have a chance to be at the table on this particular issue. It just grieves me that LaPorte County is one of the least healthy places in the state to live. And it further grieves me that 2 of the reasons we are so unhealthy are preventable. One of them is smoking, and the other one is obesity. And I'm anxious for us to find the best demonstrated practice that we can locate for how we can ameliorate those 2 issues, or at least minimize their impact. I'm also pleased that I was one of the creators of Healthy Communities of LaPorte County back when I was the CEO of LaPorte Hospital. So I applaud you for this initiative and glad to be a small part of it.
Thank you so much, Lee. Jenny Diaz.
Hi, my name is Jenny Diaz. I am the Community Marketing Specialist for CareSource, covering the Northwest Indiana territory. I am the newbie person here, and I'm pleased to be part of this Tobacco Coalition. I think it's very important, and also take notes to see what's going on in the community and how CareSource can be a part of it.
Thank you, Jenny. Andy Neal. Andy Neal, are you available to speak? Okay, we'll go back to Andy. Brittany Pickett.
Hi, everybody. My name is Brittany Pickett, and I am a program administrator with Anthem Medicaid, and I cover this territory. And part of my job is just to make sure that our members are connected to community supports. Tobacco cessation is one of the things that we try and make sure we engage our members in. And so being informed about what's going on in the community then can help us help organizations that are working with our members, but then we can also then refer our members to programs in their area to help them as well. So thank you guys for having us.
Thank you. Catherine Heavy.
Hello, everybody. It's a privilege to be part of this coalition. I am the oncology director at the Woodland Cancer Center. And I think that we have a lot of lung cancer patients that we see. And I think it's very important to be a part of the solution, so to speak, and be a part of, getting in touch with people who smoke at a young age, so they don't, develop lung cancer. Unfortunately, we see a lot of patients come through our screening programs that have, stage 3 or stage 4 lung cancer, and we just work very hard in trying to get the awareness out from our perspective, so people can have better outcomes. So I've been passionate about being a nurse my whole life, and anything that I can do to help support this initiative, it's the least I can do. Thank you.
Thank you so much, Catherine. All right, Christine.
Well, good morning. I am Christine Rosenbaum, and I am a clinical mental health counselor with LaPorte Community Schools. I've always been a big believer, big supporter of healthy communities. I can't begin to tell you what they have done as far as working with me to help educate our students. And it's a great organization to work with. And so, of course, I wanted to jump on this opportunity. Another thing is, in my role, I work with students that have substance issues, and specifically right now it's vaping. And every year we have more students vaping, and every year they're younger. Last year, I dealt with a number of 6th grade students with vaping violations, and I've had students as young as 5th grade. The kids do not understand the dangers and the impact of vaping, and parents don't always understand it as well. So I'm thrilled to be in such good company in this group, and looking forward to the strides that we can make in our county as far as tobacco prevention.
Thank you so much, Christine. All right, Denise.
Hi, my name is Denise. I am the Communication and Engagement Manager for North Shore Centers. So on a personal level, I am involved in anything I can that helps people stop smoking, because my dad died after an 8.5-year-long battle with stage 4 lung cancer. So I find it to be a very personal issue for me. In fact, my family founded a foundation in my dad's name that helps children in the same position that me and my sister were in, dealing with families with life-altering or terminal illnesses. But on a personal or on a professional level, we are expanding greatly into LaPorte County as North Shore. So we are actually going to be able to offer more services in LaPorte. So we want to know more about what we can do and how we can understand the community and serve them better, because we're very, I don't want to say into, that's not the right word, but we want to meet our patients where they are. That's the best words. It's like Monday morning in my brain, but it is like we want to meet the patients where they are. So we want to know what their issues are, what their struggles are. So all of the information that you gave us in the beginning is perfect, because we do a lot with the quit line, and we do have a lot of information on tobacco cessation that we like to provide to our patients. So knowing that it's needed more in LaPorte County will help us a lot too.
Thank you so much, Denise. Andy, I see you're back with us. Would you like to introduce yourself? Oh, take yourself off mute.
Yes. I'm sorry, I had someone that stopped by my office, so I missed that last part.
Oh, no problem.
And what are we doing?
Sorry, yes, just introduce yourself and tell us why you are passionate about tobacco prevention and cessation.
Okay. So my name is Andy Neal. I work for Northern Indiana Education Foundation in Michigan City. And we do continuing education for doctors and other health professionals. I also manage some property for them. So, my interest is I have many friends whose kids have started vaping. The parents may be used to smoke, but the kids were around it. They didn't pick up smoking, but they picked up vaping as a quote unquote safe alternative. And it's turned out to be disastrous. So between that and working with a lot of people in the healthcare industry, that's my interest in this project. And I find that the parents are fighting a very hard battle because it's hard to keep track of your kids and all the time. And apparently at school, they're very sly about how they conduct things. And the way they're marketed is pretty crazy. The products are marketed to kids, it seems, packaged like candy and the colors. And I see these vape shops popping up everywhere. And, I think it's the next big habit/epidemic that we're faced with. And the products are not monitored or controlled or regulated, so they're very dangerous. So that's my interest in this project.
Thank you, Andy. Gage Van Dyne.
Hi, everyone. I'm Gage Van Dyne with the Indiana Cancer Consortium. I'm the TBC coordinator there. And, I wanted to note real quick, it looks like down here in Indianapolis, I have all my lights on because it is about as dark as it gets during the day. We have storms. So lucky you guys. But anyways, I wanted to join, well, my as a statewide TPC person, I'm always interested in joining coalitions when I can, just to even be a fly on the wall, right? Because that kind of networking and connection within the TPC community is where the strength is. At least I believe that. And to echo what Lee said there at the very beginning, my interest, and I think what continues to drive a lot of people, is that it's preventable, right? And it causes a number of ailments, including a number of terrible cancers, right? Lung being the most prolific, and what we all know is terrible. So, that all being said, that's it. That's all being said, right? It's something to me that we can fight and we can change. So I think there's a lot of significance in that.
Absolutely. Thank you. Jean Ann Cannon.
Thanks so much, Melina. My name is Jean Ann Cannon. I'm the director of Doombrook, and Doombrook is in LaPorte County, and in some of our programs in surrounding counties, we do child abuse prevention and intervention. And our Healthy Families program goes into the homes and teaches expectant moms and new moms new parenting skills. And so, of course, we see smoking as an issue all the time, in addition to infant mortality. And of course, LaPorte Hospital, the Healthcare Foundation of LaPorte, is a big concern that supports non-for-profits with funding in addition to education. And we have a subgroup called Partners for Healthier Babies. I'm a member of that group, and we work with trying to decrease the infant mortality rate. It's been in gear for at least 2-3 years now. So we're very familiar with Healthy Families, collaborate. Doombrook sees, I think I said 140 families a month. So we're a great resource as far as trying to get referrals to the healthy communities, Melina and her group, as far as the hotline, the quit line. We've also collaborated in trying to write for Baby and Me Tobacco Free, which is another good smoking cessation grant. We have not received the money yet, but one of these days we will. And that is a very expensive but really good program. So we keep plugging away with that. But yeah, thank you all for your comments. I mean, obviously a huge problem. We need to counterattack the tobacco companies with the mucho money they use in marketing, and the reality that it, as Lee said, you know, it's a problem that can be decreased drastically, but it's the education that needs to happen. So thank you, Melina, for pulling us all together, and Sue, and your work.
Absolutely. Thank you, Jean Ann. Kelly Oliver.
Hello, I'm Kelly. I am the lung nurse navigator with Franciscan Health Michigan City. My office is at the Woodland Cancer Care Center. I work with Kathy Hebby, who already introduced herself. I was also hired to be an Aspire program coordinator, which the Aspire program with Franciscan Health is a smoking cessation program, where we've been a little stalled on that part. Hopefully it will be up and running by beginning of next year, but I am a TTS. I went through the training for it. So with my lung cancer patients, obviously I do a lot of tobacco cessation counseling with them. And then not only do I see lung cancer patients here at the cancer center, but I also follow patients that are lung RAD 3s and 4s, meaning there's concerning pulmonary nodules found through our lung screening program. So I follow up with them. I work with their primary care doctors to make sure they're getting repeat scans or biopsies or PET scans, and kind of making sure that's taken care of so they don't fall through the cracks if it does turn out to be lung cancer. And again, I do a lot of smoking cessation counseling with them, because typically most of those lung nodule patients are still smoking. And then I guess on a personal level, I mean, I've worked here at the Cancer Center in another role for a couple of years before this position. So obviously I saw a lot of lung cancer. And then also, sorry, that's my phone. Obviously, or I also had my uncle pass away from stage 4 lung cancer. It was 2 years ago this month. And he was a smoker for part of his life, but he also was exposed to Agent Orange in Vietnam. So that was a whole other level. And my father was a previous smoker, and he had worked in the mill also and was in Vietnam. So I have been on him to get his screenings. And yeah, he's finally getting his, he had a screening about 1.5 years ago, and he's going again. So it's near and dear to my heart, because he was a smoker for a lot of years. So that's it.
Thank you so much for sharing, Kelly. Liz?
Hi, I'm Liz Pina. I am the Outreach and Enrollment Coordinator for HealthLink in Michigan City. And I'm thankful to be a part of this group, so that way I can connect my patients to more resources and just be a part of the advocating for, tobacco programs that are available for families in our county.
Thank you, Liz. I think we have maybe 2 more people. So I see Sergeant Steve Walker.
Yeah, hi, sorry I was running a little late. I had another meeting going on this morning. Again, just happy to be a part of this. I served as the school resource officer for Michigan City High School for the last few years. Obviously saw, an issue with the tobacco use, especially of recent with the the vaping and whatnot, obviously becoming more popular. And again, someone else said it already, the target, of the youth, with that product. And, obviously, it's important, obviously, to prevent that at a young age. I think that, these kids are doing that without even knowing any kind of side effects of that stuff. Obviously, it's still new. We don't know the long-term effects of that stuff yet, but I'm sure they're not going to be good. And, just finding ways to help educate our young adults and juveniles about, some of that stuff, and looking forward to it. So appreciate it. And again, sorry I'm late, but glad to be a part.
No problem. Thank you so much. And then Tay Lethbridge.
Hello, everybody. My name is Tay Lethbridge. I am the Community Healthcare Liaison for Artemis for Women. And specifically, I work with pregnant women, not only for tobacco cessation, but also any high risk needs that they may have, whether it be a social determinant of health or whether it's an actual health issue. And so being a part of this coalition is one, like most people said, a way to network, but also a way to see how we can reduce the infant and maternal mortality rate.
Absolutely. Thank you, Tay. I believe I called on everyone. Is there anyone I missed? All right. Okay, thank you all so much for sharing and sharing those moving stories that you all have. It's clearly an issue, and like a lot of you said, it's preventable, and I hope that we can really work towards reducing that in LaPorte County. So now we're just going to jump right into what our tobacco prevention and cessation program is. So I'm going to share my screen with a short slide deck. Can you all see my slides? Perfect. All right, so let's jump right in. This is what our coalition is all about. I have the Indiana Department of Health logo there. They are our funders for all of our tobacco prevention and cessation work here in LaPorte County. All right, so our program is run through grant funding. We applied for the new grant cycle in March of this year, and we were approved for the grant for 2021 through 2023 grant cycle. And so yay, thank goodness. We are currently on month number 2 of the new grant cycle, and we have it through June of 2023. So I wanted to explain the background for the funding. So it all started with the 1998, in 1998 when the Master Settlement Agreement was made. And so what that agreement was, it was between the major tobacco companies, 46 US states, the District of Columbia, and 5 US territories. And this settlement transformed tobacco control. It was the largest civil litigation settlement in US history. The states and territories scored a victory that resulted in the tobacco companies paying the states and territories billions of dollars in yearly installments. So aside from that settlement money, they also agreed to some tobacco prevention and cessation provisions regarding advertising, marketing, and promotions of cigarettes. I can go on and on about this, and there are a lot of issues and loopholes within this. But for the sake of time, I just want you all to know that that's where our funding for this programming comes from. So the Indiana Department of Health and their Tobacco Prevention and Cessation Commission, they allocate, I'm gonna ask that you all mute yourselves. I hear some background noise. Yes, so the Tobacco Prevention and Cessation Commission with the Indiana Department of Health, they allocate a portion of that funding towards tobacco prevention and cessation programs in the counties all throughout Indiana. And Healthy Communities of LaPorte County was granted that funding for tobacco control in LaPorte County. So that is what we do. So the Tobacco Prevention and Cessation Commission with the Indiana Department of Health, they develop a tobacco control 5-year strategic plan. And the one that we're using now is the 2021 to 2025 plan. And they developed this plan alongside many subject matter experts, and it serves as a roadmap for the entire state of Indiana. It's coordinated by the Tobacco Prevention and Cessation Commission with the state, and it's implemented by tobacco program coordinators around the state. So for LaPorte County, we are the ones who implement it here because we received that grant funding. So here's the vision and the mission. So the vision, So the vision of the strategic plan is in Indiana where all are free from tobacco addiction and exposure to commercial tobacco products. And the mission is Indiana Tobacco Prevention and Cessation seeks to achieve health equity by eliminating the disease and economic burden associated with tobacco addiction and exposure to commercial tobacco products. I want to point out that you see the word commercial tobacco products, and those are manufactured by companies for recreational and habitual use. And we want to start using the word commercial to differentiate between recreational use and then use for sacred, spiritual, and ceremonial practices that some Indigenous communities use tobacco for. So I just wanted to let you know about that. So as you can tell from the vision and mission, they really have a health equity focus, which I'm very happy about. So because of that health equity focus, I wanted to explain to you what tobacco-related health equity is. So it is the equitable, fair, and just opportunity and conditions for all people to live a healthy life free from commercial tobacco-related disease, disability, and death, regardless of race, ethnicity, age, sex, income, level of education, gender identity, sexual orientation, the job they have, the neighborhood they live in, and the type of insurance they have, or if they're uninsured or underinsured, or whether or not they live with a disability or substance use disorder. So this is very thorough. So our funders, they encourage us to have a health equity lens in all of our tobacco control efforts. And that is exactly what we're going to do. So with that in mind, these are the 4 priority areas for the tobacco control strategic plan. So 1, decrease tobacco use rates among Indiana youth and young adults. 2, increase the proportion of Hoosiers not exposed to secondhand smoke. 3, decrease Indiana adult smoking rates. And 4, maintain state and local infrastructure necessary to achieve health equity by eliminating tobacco addiction and exposure to commercial tobacco products. So this strategic plan and its priority areas are embedded into our work plan for this county. So the tobacco control work plan. So this is all that, this is everything that we have to do in tobacco control in LaPorte County. And what we'll be working on as a coalition. So this is a big picture outline of what the work plan entails. So it consists of 4 priority areas, and you'll see those in blue. And these should look very familiar from the priority areas in the strategic plan that I just showed you. And for us, there are 11 community indicators you see in yellow, sorted under each respective priority area. So the work plan goes a step further and lists specific deliverables we have to accomplish with deadlines. So I submit a monthly report to the state explaining exactly what I did for each of these yellow indicators. But I won't get into the specific deliverables today. I will be diving into what these community indicators mean to give you a sense of the type of work we will be doing together. So let's dive in. So starting with priority area 1, these 3 indicators under it in yellow are areas that we do work in order to accomplish that priority area. So for middle and high school prevention, that would look like providing prevention or tobacco prevention and cessation information to schools, making sure school leadership and teachers are informed on tobacco burden and various tobacco issues. For youth empowerment and voice, that would look like recruiting a group of teens, empowering them to become advocates for tobacco lifestyles, and teaching them how to be leaders in policy and legislation. For a point of sale, which Shirley talked about a little bit, that would look like gathering volunteers to participate in surveying the retail environment pertaining to tobacco products and how they're advertised and marketed. It also includes educating the community on point of sale marketing and how the tobacco industry targets youth and other marginalized communities. So on the next slide, I'll give you an example of a deliverable we are currently working on for that indicator. So moving on to priority area 2, the 3 indicators in yellow are areas that we do work in to address that priority area. So starting with tobacco-free work sites, that includes educating the community on the importance of a local comprehensive smoke-free air ordinance that covers all workplaces, including bars, membership clubs, casinos, and to assist in helping implement that ordinance here in LaPorte County. For tobacco-free schools, that would look like assisting schools in improving their smoke-free grounds policy and encouraging and helping them create non-punitive alternatives to suspension and citations for policy violations. For tobacco-free multi-unit housing, that would look like forming relationships with local public housing authorities, managers of apartments, townhomes, etc., and educating them on the importance of smoke-free grounds and helping them implement smoke-free grounds policies. Moving on to priority area 3, the 2 indicators are areas that we do work in to address that priority area. So the first one is Quitline, and that includes conducting outreach to healthcare providers in diverse settings and educating them on the Quitline as a free cessation resource and informing them on how to refer their patients to the Quitline. For employers, it's very similar. That includes conducting outreach to employers in diverse settings, educating them on the Quitline and the importance of offering cessation benefits to their employees and having tobacco grounds policies. Finally, for the last priority area, the 3 indicators are areas that we do work in to address that priority area. So starting with coalition, that is the formation of this group to build intersectional and authentic partnerships to help create collective impact to help us address tobacco use in our county. For marginalized populations, that includes identifying disparities in all diverse communities in our county, engaging them and recruiting them to be a part of our coalition so that our coalition is truly representative of LaPorte County's entire community and not just pieces of it. And lastly, for tobacco-free families, that includes training Head Starts and also alternative settings that serve low-income families on a program called Breathe: Healthy Steps to Living Tobacco-Free. So that is just a taste of the kinds of activities we will be working on together. The entire work plan is based in best practices and a tobacco control model developed by the Center for Disease Control and Prevention, the CDC. And as you can see, it's very comprehensive. It goes through so many different sectors of our community, and that is what public health is all about. So moving into the last slide here, this is a flyer for a community conversation event we are having on September 28th. We are really excited about it. This event is, it meets a deliverable on our work plan for the point of sale indicator. It is really about educating the community and getting the conversation started around point of sale marketing and the impact of tobacco products on youth, especially flavored tobacco products, and how the tobacco industry uses manipulative marketing tactics to target our youth and marginalized communities. So this should be a very informative event, and we hope that you all join us. It is from 8 a.m. to 9:30 a.m. with registration starting at 7:45. It is at the Healthcare Foundation of LaPorte County's Learning and Conference Center, and it includes a keynote speaker from the American Heart Association, a panel of healthcare providers, school leaders. Shirley will also be a speaker, and we hope to recruit a youth panelist as well. We have some partners scouting for youth for the panel, but if you have any specific youth in mind that you think would be a good panelist, please let me know. And also please share our flyer with your networks. We have no idea what to expect in terms of attendance, but we are trying to widely distribute it, and it is a hybrid setting. But we are requiring RSVPs because the in-person setting is limited capacity. But if you did not receive the flyer, I sent it out yesterday. Just please let me know and I can send it to you again. So I will stop screen sharing here, and I just have a few more comments. So the expectations for this coalition are for us to work together to accomplish our work plan deliverables by sharing our skills, our resources, connections, and more. I want us to be all active participants in this coalition. And I also want us to build those mutually beneficial and authentic relationships with one another. There are also other valuable benefits to this coalition, such as trainings, guest speakers, opportunities to speak about your agencies, networking and volunteer opportunities. So there are a bunch of benefits. One final expectation, though, that I think is very important is to just have fun. This work is challenging, but it's also extremely rewarding. And we will celebrate the smallest accomplishments and the biggest accomplishments. And as you heard Shirley say earlier, we can really make change together, and that's exciting. So some quick logistics: we'll meet once a month virtually for now, and we will be forming action-oriented subcommittees to break down the work plan and give you all opportunities to contribute to the topics that are most important to you. I wanted to get into questions and answers today, but we are running out of time. So if you have specific questions, you can put them in the chat box or email me, and I will make sure to get those to you as soon as possible. So again, please share the flyer, the community conversation flyer. If you know of a youth for that event to be on the panel, please let me know. If any of you know people who would be interested in this coalition, please share our information with them. We'd love to have them and help this coalition be representative of our whole community. Finally, kind of an action item for you all is to expect a phone call from me between now and our next meeting to really get to know you better and to determine what subcommittees you're interested in. All right, so our next meeting is Wednesday, September 22nd at 10 a.m. Central Standard Time, and I will see you all then. Thank you so much for joining us today, and I hope you all have a wonderful day.
Thank you.
Thanks, Melina. Great job.
Thank you. Bye-bye.